I was talking to Janet about it, and I know that you'll do the whole body treatment because diet is so important when it comes to skin health. So speaking of skin health and some skin disorders, skin problems, eczema. I bet you have a lot of information on eczema.
Yep, eczema. Here's the secret to eczema. It's in the name. Eczema is kind of a colloquial term, but the technical term for eczema is atopic dermatitis. So eczema is what we all call it, but the technical medical term is atopic dermatitis. And really in the name, in the diagnosis, in the term atopic dermatitis, you have everything you need to know about what the etiology is or the cause is and how you treat it. Atopic means it's not topical. It means without, right? That tells you right there why most eczema treatments don't work. It's not a topical issue, although it manifests obviously topically. But even in the name, it's called atopic dermatitis. Derma means the skin. Atopic means it's coming from inside. It's not topical. And itis means you have an immune/inflammatory condition. So eczema, what we call eczema, is an immune/inflammatory because the immune system is how inflammation is how the immune system shows up. So inflammation is the front end, but the immune system activation is the back end. Derma, the skin. Atopic, it's starting from inside the body. So you've got an immune condition that shows up as inflammation that starts off inside the body. That's all you need to know. So number one, it's internal. So if you're going to treat it effectively, you got to start on the inside. The immune system is largely housed in the intestine. And this is the key to understanding eczema. It starts off intestinally. It starts off at the level of the intestine, which means you've got food issues, you've got intestinal issues. Both of these combine to form a condition where factors get into the bloodstream, immune factors and inflammatory factors get into the bloodstream, they end up in the skin, and you end up with an immune issue on the skin that affects the barrier, the skin surface, and that's where the symptoms of eczema come from. So what do? You work on the digestive system first and foremost. When you work on the intestinal system, the digestive system, not only do you end up with better eczema, but you end up with better digestion, and other immune issues will start to resolve as well. And we know many eczema patients also deal with asthma. We know many eczema patients also deal with ear infections, especially children, chronic ear infections. We know their immune manifestations are associated with atopic dermatitis, which makes sense because you got an immune condition. And the immune system operates as a whole. So when you work on the immune system at the level of the intestine, it benefits for ear infection, for asthma, for other immune conditions. Plus, you work at the causal level and you get resolution of the skin problem. So what does that mean to work on the intestine? Well, first of all, you always eliminate problem foods. That's the first thing you do. Most likely problem foods, although it's not limited to these foods, these are the most likely suspects: dairy, peanuts, eggs, soy, and legumes and beans. I think I'm missing something here. Grains, cereals. These are the most common triggers, immune system triggers. Those should be eliminated. And don't just go by the most common. See what kind of triggers you notice in your skin or in your child's skin. What is associated with their breakouts? If they have digestive issues, usually they do. What foods are associated with the digestive system? So while there's likely suspects, it could be other things too. That's the first step, eliminate foods. Then you start to work on intestinal health. Obviously, good bacteria, probiotics, a good probiotic supplement. I'm sure you have good probiotic supplements over there at Moses Lake Pharmacy. Probiotics are, we graduated around the same time. I think I graduated a little earlier than you. Probiotics weren't really a thing back then. Today, we know that good bacteria play a very important role in the health of the immune system, the health of the digestive system, and ultimately the health of the skin as well. So getting on a good probiotic supplement, eating fermented foods can help, making sure that you're getting enough fiber. Number one, because it helps feed the probiotics. Number two, because it helps clear out the bowels. Fiber is very important for folks who are dealing with constipation, and clearing out the bowels is a very important way to detoxify. You can also use nutrients that help strengthen the intestinal lining because leaky gut is oftentimes an issue when you have immune conditions that are related to the intestine. So things like glutamine, which is fuel for the cells that line the intestine, collagen building supplements, slimy nutrients, things like mushrooms and algae and aloe vera. It's interesting, slime, I call it slime, it's really polysaccharides. practically. These slimy substances have immune supporting properties. So things like aloe vera and algae and noni juice and mucopolysaccharides from succulent plants in general, and mushrooms all have immune boosting properties and intestinal strengthening properties too. Then there are nutrients that are specific for the barrier, for strengthening the barrier. You know, a lot of times people don't realize this, but the skin is stratified. I know we've talked about this before. It's layered. You have it doesn't really look like it's layered. It's kind of weird to think that it's layered, but indeed it's layered. The layers are microscopically thin. And people who have eczema typically will have issues with their surface of their skin, the barrier, the so-called barrier. A lot of this is related to the digestive system. So when you work on the intestine, that will support the barrier. But you can support the barrier also with nutrients, with supplements, specifically fatty supplements. Essential fatty acids are a must-have. I mean, must-have, not only for eczema and dermatitis, for any skin problem. By the way, dry skin is also a barrier issue. So when you use essential fatty acids, not only will you be supporting the barrier if you have eczema, but you also be supporting the barrier to keep it to prevent water loss, so-called transepidermal water loss, or TEWL. It's great for skin moisturization. Also, the mineral zinc and the mineral selenium play a very important role in keeping the barrier strong and healthy. And one of the most important nutrients for strengthening the barrier is something called phospholipids. In fact, phospholipids are an integral part of not only the skin barrier, but also of skin cells themselves. Lecithin is a classic example of phospholipid, using lecithin granules or using supplements that contain lecithin. And then there's a lecithin phospholipid-rich food that is the skin's favorite food. In fact, it's the body's favorite food, and that is eggs, which contain phospholipids as well as essential fats. The one caution with eggs, of course, is if you have an egg allergy, and egg allergies are somewhat common, so those will be contraindicated if that's the case. But if you don't have an egg allergy, eggs are phenomenally valuable for the skin, for all skin conditions, including eczema. Topically, there are some things you can do to soothe eczema. You're not going to be able to completely eliminate eczema topically, but soothing eczema may be maybe something that you want to do, maybe an effective palliative strategy, although it's not going to be curative, using zinc oxide, topical zinc oxide, topical fat-soluble vitamin C, and then if worse comes to worse and you're absolutely miserable, hydrocortisone, a topical steroid like hydrocortisone you can use, but I don't recommend people stay on hydrocortisone because you can get rebound conditions and dependencies, and those are things that you don't want. And so hydrocortisone isn't something you want to stay on, but if you're absolutely miserable, that can be helpful. Likewise, Benadryl topically, if you compound it topically, or using Benadryl orally, that can help with the itching misery. But again, these aren't curative strategies or palliative, although they may be sometimes warranted depending on how severe the eczema is.
Wow, that was a lot. And so basically, you have to cure from the inside.
Absolutely. Yeah. Atopic dermatitis. It's not topical.
Awesome. Well, I appreciate your information. We will share this to our patient. Thank you so much, Ben.
Thank you.